This is a video brought to you by NHS Tayside Children and Young People's Occupational Therapy Service on sensory processing and daily occupations for professionals. Our department has been running parent and education sensory training sessions for a number of years now, and we know that raising awareness of sensory processing difficulties to those who are closest to the child or young person results in the best outcome for that child and family. We also know that children's sensory processing difficulties are often most obvious and prominent when children are surrounded by those that they trust, whether they're at home or at nursery. So today's session is to increase your awareness of the role of occupational therapy, to increase your understanding of what sensory processing difficulties are, and to increase your awareness of the sensory processing training that we provide in occupational therapy, when to signpost parents to it, and how to access useful resources. As occupational therapists, we're interested in day-to-day occupations, with occupations being the things that you want to do, need to do, and are expected to do in everyday life. Some examples of occupations can be getting dressed, having your hair cut, eating meals, learning to ride a bike, things we do that have a purpose and meaning. And all of these occupations make up our day-to-day life and the certain habits and routines that we have. It's important to note that all of these occupations can be impacted by a child's sensory processing. Within occupational therapy, we work on a tiered approach. So we've got 3 different tiers of model of intervention. We have our universal level, which are resources such as our website, our Facebook, and our Instagram, which is accessible for all children and young people. We also have our targeted input, and this is for our children and young people who are at risk or already identified as having wellbeing needs. Our training today, some consultations that we offer, and corridor conversations are all used in a targeted way. Then we also have our specialist level of intervention, and that's for those children and young people whose wellbeing needs can't be met through these universal and targeted provisions. The evidence shows that increasing knowledge in those closest to the child has the most impact on them being able to manage their sensory difficulties. We know that when adults change, children change. So it's important to think about the environment the child is in and how we can change and adapt this for them. As occupational therapists, we are interested in sensory processing because it can have a significant impact on a child's ability to participate in their occupations. These are some of the terms that are often associated with this. Some of you may have heard the term sensory processing disorder. However, this is an Americanized term and it's not a recognised diagnosis in the UK. In the UK, we would use the term sensory processing difficulties or sensory processing differences. Sensory processing difficulties can happen on their own or can be part of a formal diagnosis, such as the ones highlighted on this slide. So, for example, sensory processing difficulties are prevalent amongst children with autism spectrum disorder and would make up part of their diagnosis. Before we talk about the individual senses, this slide here helps us to think about the role of the brain and the responses that we might see from children. On this slide, we know that the primary job of the brain is to keep us safe, and the secondary job is to allow us to function in everyday life. The safety brain is constantly monitoring our environment for danger. Our brains are wired to register changes in our environment, which is all happening at a subconscious automatic level. Our safety brain is automatically kicking into that fight, flight, or freeze response if we feel uncomfortable or unsafe. We often say, for instance, if a tiger walked into the room right now, you wouldn't continue to focus on this training video. You would perhaps run, hide, attempt to fight it or scare it off, or you might find yourself frozen in fear. All of these are really normal responses. We don't choose how to respond. It is automatic, as these primitive reactions are overriding that learning brain. The secondary role of the brain is to help us function. So for some children and young people, this might be sitting in a class to concentrate, getting themselves dressed, trying new foods, or socialising. In order for the brain to do this, it needs a wide range of sensory information. What is really important to remember is that when your safety brain is active, it is harder to function as you're in a highly overwhelmed state. We often get asked, is it a sensory thing or is it a behaviour? There's not often a straightforward answer. However, what we do know is behaviour approaches won't impact a sensory need, and sensory approaches won't impact a behaviour. This is where knowing the child, watching, and being a detective can help. We often give the example if a child doesn't like putting their socks on, it could be that they're really sensitive to the sensation of the socks, and to them it might feel painful, or it could be that putting their socks on means they have to stop playing their favourite game and go to nursery or school. If the child's able to respond to motivators, so it's stickers or a reward chart, their actions are more likely to be behavioural rather than sensory. However, often things can start as a response to sensory input but turn into a behaviour because the child likes the reaction from the adult. This behaviour can then become repetitive. So here we've got our five senses that you're probably most familiar with: our hearing, taste, smell, vision and touch. All the sense information that we receive from the world around us from the outside. For hearing, our ears are gathering auditory information about the sounds within our environment, such as passing traffic noise, a phone ringing, or a voice speaking to you. For seeing, our eyes collect information from all the visual stimuli within our environment, such as the things we see, their shape, their size, their position, and changes in light level. For taste, this is made up of lots of receptors on our tongue and within our mouth, and they are detecting the different substances that we put into our mouth to help us make sense of them. Our taste, tactile, and our smell systems work really closely together when we're eating and experiencing food. For smells, our olfactory system is the information gathered from our nose. This alerts us to potential dangers such as gas or smoke. This information is processed near to the memory center in our brain and can trigger an emotional response that is associated with our stored memories. For touch, our tactile system is one of our largest systems. It's not just what we touch with our hands, but also how we experience things through receptors across our whole skin system, which can detect environmental factors such as room temperature and if things touch the skin and how that makes our skin feel, for example, tickly or painful. We do, however, have three further sensory systems, which is all the information coming from within us. Firstly, our proprioception is related to body awareness, and this sense gets its information from receptors in our muscles, ligaments, tendons, and joints, all the bits underneath our skin. It lets us know the position of our body parts and our position in space without needing to look. It is especially helpful for efficient movement and helps with determining correct force to use when carrying out a task, such as grasping an object or throwing and catching a ball. Proprioception can have a calming and organizing effect on our central nervous system, and it can actually help override responses to other senses. So it's definitely one to remember when we start to think about the senses in more detail. Vestibular sense, or our balance system, is the information that the brain gathers from some fluid in our inner ear. This helps the brain process different types of movement. For example, it helps to determine whether the body is moving and which way up we are. We can also think about different types of movement and the effect that they can have on how we're feeling. Think about the differences in backwards and forwards movement versus rotational and spinning movement. Our vestibular sense works alongside our proprioceptive and our tactile systems to help us maintain posture. And because of where the vestibular system is located, is also connected to our auditory sense. Then we've got our interoceptive sense. Interoception is the receptors in our organs, skin, and muscles, which tells us how our bodies are feeling. This produces sensations such as hunger, thirst, feeling hot or cold, tired, needing the toilet, feeling sick or in pain, feeling your heart beating or your breathing getting faster. Our interoceptive sense is linked to our emotional feelings, and it's very important for our self regulation, which is our ability to control the way that we feel and act. Although we've talked about all of the senses separately, it's important to remember that these senses need to work together to help us to function. If you think back to the job of the brain, our brain needs a range of sensory information to help us function, carry out the things that we want to do, need to do, and have to. We're going to go back to talk about the brain and think about how our senses are processed. We've got an example here of a child who wants to colour in, but this could be a child doing any task, whether it's concentrating in class, getting their hair cut, or getting dressed. You might have the background noise and flashing images of the television. You might have a sibling making noise in the background, the sensation of your clothes on your skin, the sun shining through the window, and information about your posture. The sensory information from all 8 sensory systems is fed into the brain at a level beneath our conscious awareness. This includes all the sensory information from inside and around our environment. This is demonstrated here by the cars at the bottom. We have a filtering centre, which can be described as being like a toll gate in a system of cars. The toll gate is filtering out any of the unwanted or unnecessary information, as shown by the cars leaving the brain in the picture. This might be things such as background noise outside a room where you're trying to concentrate, or the sensation of your clothes, or in this example, the sound of the television or other children playing. The rest of the sensory information is then sorted, processed, which allows the brain to send a signal to the body to carry out an appropriate motor or behavioural response, which you can see by the child in the top right being able to focus on the task that they're doing at that moment. But we know that this doesn't always happen. Sometimes the filtering centre or toll gate of the brain is filtering out too much of the information coming from the senses. So imagine the same example of a child in the situation. You've got the same amount of sensory information coming in, but the toll is filtering out too much, including actually some of the information that is necessary for being able to focus on the task, such as body awareness. This means there's very little sensory information available for processing and sorting, and the brain does not have enough information to perform the correct action as a result. It could be that there's 2 scenarios in this situation that we might see. Firstly, we might see a child that is seeking a lot more sensory input, again, albeit below the level of consciousness, so the child isn't making a choice. In this situation, the brain tends to look for more information rather than just accept that it does not have enough. For instance, the brain may send a signal for the body to move or to make noise, as that is a way of increasing the available information from the senses. So you might have a child who hums or plays with something when they're listening to the teacher. Another example that we may see is a child who appears very lethargic or understimulated because they're waiting for more sensory input to help them because there's nothing for them to attend to. In this slide, we've got the same scenario as before, the child trying to focus on colouring in. However, sometimes the filtering centre or the toll gate does not filter off enough of the irrelevant information from our senses. This is shown by the small number of cars leaving the brain in this picture. This therefore means that there's too much information for the brain to process, and it can't be done in an ordered or structured way. The brain can't make sense of all the information in order to tell the body what to do. Again, there might be 2 scenarios that we might see which are at an unconscious response by the child. Firstly, you might see a child experience feelings of being overwhelmed, and that leads them going into that fight, flight, or freeze mode. So you may have a child that covers their ears, they might hide under a table, or they might run away to actively avoid some of the stimulus. Secondly, we might see the child that's trying actually to react to every stimulus, so they appear very distracted and very busy. They may be slow to react to instructions as they're too busy reacting to everything else, such as the sound of a ticking clock. We know that most individuals will go through having all 3 of these states at different points throughout the day, depending on a range of factors. As occupational therapists, we talk about being in a just right state, meaning that we're at the right level of arousal to carry out the task or activity we need to do. For most tasks, this will be a calm alert state where we can concentrate and attend. However, low arousal may mean that we're sleepy or distracted, which can make it impossible to attend to a task. This can be contributed to by our environment. Things like low level lighting, gentle music, or being too warm can send many of us towards the lower end of our arousal levels. This is different for everyone, and what may help one person concentrate might make another feel drowsy or distracted. In a state of high arousal, we may be agitated, overexcited, confused, or anxious. Environmental factors such as workmen drilling outside, having the sun in our eyes, a chaotic or messy environment, or even frustration with IT can all contribute to this. So if you think about the bottom line being your day from when you wake up in the morning to when you go to bed at night, there'll be various things that are expected of you, or things might actually happen out of the blue, which may be triggers or cause a build up throughout the day. So, for example, when you wake up in the morning, we all need something to help increase our state of arousal. So, some of us may have a cup of coffee, we may stretch, we may listen to music to help give our brain the information it needs to help us function and to start our day. However, as things happen throughout the day, we fluctuate between having too much or too little sensory information, and our brain works really hard to send messages to our body to help us regulate. However, for many of the children that we see, it is much more difficult to get into that just right state, and they have a narrower range where they feel calm and alert. This is because their sensory systems can over or underreact to the environmental cues around them, making it much more difficult to attend to a given task. A busy or noisy home or classroom environment may make it difficult for some children to remain focused on tasks, like eating their dinner or doing their schoolwork, as they cannot filter out the additional auditory information, which could send them into a high level of arousal. Other children may not register enough auditory information to attend to what's being said by their parent, so that may remain in a state of fairly low arousal and appear to ignore their parents speaking. The same goes for other environmental factors such as our vision, touch, and smell. Let's take a little minute to think about our own sensory systems. Do you find yourself chewing on pen lids, chewing your nails, chewing gum when you're nervous or when you're trying to concentrate? Do you notice that you might sit cross legged and bounce your knee? What about things like fidgets? Are you doodling while you're listening to me talk or playing with a paper clip or a pen? These are all sensory based behaviours, which ultimately helps us provide the brain with the information that we need in that given moment to concentrate, focus, and to listen. There are various ways that people can access our sensory training. On our YouTube, we have recorded versions of our parent, teenager, and professionals in education sensory training. On our website, there is a tab under sensory where we advertise all of our training dates that parents and education staff can book onto, whether they are virtually on Microsoft Teams or in person for some of the dates for parents. Within our service, we do offer sensory consultations to parents and carers as a next step after the sensory training. This is where they can phone in and book either a phone call or a Teams call with an OT in their locality area. These are for parents and carers to have an opportunity to discuss with us any specific concerns or occupations that they and their child are struggling with. We also have a sensory checklist which is available to download on our website. This can be helpful for parents, carers, and education staff to do to see if there's changes within the child, but also if they need to show this to anybody else that is working or known to their child. The checklist gives an idea of thinking about what strategies to start with first. On this slide, you can see here that there's a spike in body awareness and tactile input. So our suggestion would be for parents and carers to start trying some of these strategies around that sense that they will have got from the training, such as deep pressure, pushing and pulling. We also have our YouTube channel, which has loads of great resources with more strategies around sensory processing and daily occupations. And our Kids Scotland website through NHS Greater Glasgow and Clyde has some more strategies and also a sensory resource which creates an All About Me document, all linked to sensory processing. This can be a bit lengthy, but it is a helpful resource to signpost to some families if they're looking for a booklet of strategies for their child. This is a problem solving tool. We often talk about this like it's an iceberg analogy, where the tip of the iceberg is the behaviour that we might see, but below we have some of the contributing factors that might be causing the behaviour. It's quite a helpful resource that we signpost families to look at, to sit down and to do with those closest to them or their nursery or their schools and think about some of the things they want to try and think about strategies that might work, as it's often quite overwhelming to know where to start. This QR code will take you all to a Padlet, which has all of the resources in one place for us. So we've got a copy of the slides, we've got strategies, we've got our checklist and scoring sheet, contact details, as well as many new links to videos and resources that we've created. And lastly, there's multiple ways to get in touch with us directly, and please don't hesitate to do so if you need any advice or guidance with regards to any of the children that you're working with around sensory processing difficulties. Thank you for listening.